Welcome back, my good people, and in today's video we are going to learn more about stethoscope. If you come to the hospital, you will see doctors, clinical officers and nurses having this particular gadget in their chest, and you wonder why, what are they using it for? And sometimes you've been sick and they have used this to listen to some of the sounds in your chest, and now you are asking yourself, what is this all about? Now, this video is meant for general population, those who want to join medical training colleges, so that they can be well conversant with this particular gadget even before they join college. Now, stethoscope is the name of this gadget, and this is from a company, this is a brand called Littmann's. Is the most outstanding special stethoscope you can have around, and it's quite very expensive. This one of mine is not so much expensive. This is the least. It's around 8,500 Kenyan shillings. That's around $80, and you can get as high as 200,000 of this particular gadget, depending on the price and maybe the prestige. Now, stetho is a Greek word meaning chest, and scope also. There are ancient Greek words which means to look, inspect, visualize. So the word stethoscope, if we define it, is that it's a gadget that is used to listen, and even what we call in medical term auscultation. You listen for the heart sounds and the lung sounds, and even in your intestine, the abdomen, that is bowel sounds. And sometimes you can use them to listen for what we call brutes in the neck, and those ones we will learn later. Now, this particular gadget runs down from 1816, and it was invented by French physician, and it has a very long name, in fact 4 names, called René Laennec Théophile Hyacinthe. In 1816, this guy was examining women, and every time, they used just to put their ear in the chest and listen to the heart sounds. But this guy found that it was not so much good to be listening to each and every female with his ears towards the chest. So he invented this particular stethoscope that I'm going to show you, or this one you are seeing around here. Now, after that, it evolved up to this particular time that now you see a gadget like this, and we should be able to know this gadget. It has some parts that we should know. Which one is this? This is an earpiece. These small tubes, these black ones are earpiece, and then this is an ear tube, and this long one is called tubing. This long one is called tubing, and this one, the bigger part, is called diaphragm, and the smaller part is called bell. And there's a nipple somewhere here called stem. Now, when you have this particular gadget, because it's very expensive, you should be making sure that you look at it very well so that you don't spoil it. Now, uses or function of this particular gadget. Why do doctors, clinical officers or nurses have this particular gadget? This particular gadget helps us in making diagnosis. Many diseases are diagnosed because of this particular gadget. And when we are using it, we use it via your chest, listening for both the lung sounds and the heart sounds. We can place it in the neck, and that's a special one. We can put it even on the temporal region on the head, or the kidney, or even in the kidney region, or even in the abdomen, to listen for the bowel sounds. Those ones we are going to learn into details. Number 1 use of this particular gadget is to calculate blood pressure. We have very many kind of blood pressure machines, but the one that has mercury, called sphygmomanometer, we use this particular gadget, and it helps us to calculate both systolic and diastolic blood pressure, and this one may help us to make a diagnosis of hypertension, and it also will help us to grade which type of hypertension you have. Is your blood pressure normal, or do you have pre-hypertension, or do you have hypertension stage 1, or you have hypertension stage 2, or what we call hypertensive crisis. So we should be able to know the normal blood pressure for all those particular conditions. So blood pressure is very, very important, and the normal values are shown in the diagram as you are seeing. Number 2, this particular gadget helps us to listen to the lung sound. When you are a student, there is a topic you will be learning about respiratory system in systemic examination, and this is very, very important gadget when you are listening to the lung sounds. And even before you listen to the lung sounds, you'll be taught about anatomy and physiology of the lung. So when we are talking of the organs, you know what we mean. Now, this gadget will be able to help us to differentiate between the normal sounds and the abnormal sounds. Right from the trachea, and these are the trachea sounds, and then to the bronchus, we'll be listening around bronchial areas, then bronchiovesicular around this part, and even then the vesicular breath sound. Those are normal. Now, you will also be learning about the abnormal breath sound, that is rales or crackles, stridor, rhonchi. And this particular gadget will help you when you are learning to differentiate all those when you are listening to the lung sound, or what we call auscultating of the lung sound. Now, it will help you to make a diagnosis of either this patient is suffering from asthma, or this patient is suffering from chronic obstructive pulmonary disease, or this patient is suffering from emphysema, or this is a patient who has a pleural effusion, that is fluids on the lungs, and even asthma. So this particular gadget is very, very important, and even before you send a patient for chest x-ray, or even CT scan, or even MRI, you will be able to know this patient is suffering from pneumonia. Number 3, heart sounds are very, very important. We have sound 1, 2, and then sound 3. The so-called, the normal one that we call lap dap, that is the normal heart sound. And you will be taught on how to auscultate the 5 major areas that you should be able to auscultate. Either aortic part, pulmonary part, what we call Ebb's points, the tricuspid part, and the mitral part. And it will also help you to diagnose any heart diseases, either mitral valve regurgitation, either pulmonary disorders, or either tricuspid valve, or the heart murmurs, either systolic murmur or diastolic murmur. So this particular gadget is also very, very important in diagnosis heart diseases, and you will be taught those points that we auscultate as you see them in this particular diagram. Very, very important. Now, I talked about placing this particular stethoscope over the neck. That was called the bruit. Bruit are whoosing sounds when there is narrowing of the arteries. So when you put its ear, you will be learning about what is the normal sound passing through the trachea and which one is the abnormal. So if you have a friend who is not sick, he is having no condition, just put the stethoscope over the neck, and that is normal. When you will be hearing some abnormal sounds, then I will put a link in this video that will redirect you to normal sounds, both the heart and the lungs, and the abnormal sounds, so that if you are talking about a bruit in the neck, or bruit in the kidney area, or the femoral areas, or even the temporal area, or even the umbilicus area, they can be bruits. So you will be able to know that this particular one is a bruit, it's not a murmur. And when you are having constant practice, you will be able to differentiate all those. Another function of this particular gadget is to help us in what we call vowel sounds. Vowel sounds. There are some sounds that you have that is normal or abnormal. When you've eaten, you feel a sound in your stomach, rumbling, that can be normal or sometimes can be abnormal. There's succussion plus if you are splash. If you've drank a lot of water, and you shake your abdomen, you will feel that particular sound. That is called succussion. Splash, that is normal. In cases where there is obstruction or even paralysis, you will be able to learn when the bowel sounds are increased or when the bowel sounds are not present. What does it depict? So this particular gadget is very, very important in bowel sounds. Now, another function is that those who have hearing impairment, when somebody, this is just like a deaf edge gadget. You will be putting this particular, this will be pointing forward like this. You should be able to put this and in that person, in the patient's ears, and you can talk through it, blah 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 blah, or you can even tap and ask the patient whether he's hearing any sound or not. Of course, there are also some procedures that are done to determine whether both ears are functioning. But now, in relation to this video per se, this particular stethoscope can be used in helping those who have hearing disorders. Now, another one which is very, very important but rarely do we use it is that determining the liver size. One, you put your hand on the midline from the nipple, and then with your stethoscope like this, you will feel there's a lot of sounds. This means that there's some impairment of the liver, but most people do not use stethoscope to determine the liver size. Other body functions, body sounds are also very, very important, particularly if somebody is from surgery. We listen to those bowel sounds we were talking about, or just normal practice of listening to the heart, or listening to the neck, or listening to the lungs. Now, when you are using this particular gadget, you should be able to take care of it. Sometimes tension can reduce, and you find that this particular part is higher than this particular part. This can impair the sound vibration. So you make sure that this gadget, these ones are like in the line in each other. They are parallel to one another like this. So if you find that they are not in order, you just simply pull this and you make sure they are the same. And when the tension is also high, you can reduce it by doing this and doing this. And this one should be pointing straight, pointing forward. You don't put it like this, but you put it on your ear like this, and then to the part you are auscultating and you listen to it. A special part is that I talked about stem. This one you can turn and rotate, particularly when you want to listen for some special murmur, systolic murmur, diastolic murmur. You use this particular part of the bell, that is the bell. You use the bell and you auscultate those 5 major points that we were talking about. Because I like Littmann's, because it's a very, very important and very fine-tuning the heart sounds and the breath sounds. We should be able to keep it very, very clean, meaning that 70% alcohol propionyl you use in wiping it. Don't use oil or emulsions, or don't even microwave it or steam it, because it will spoil the tubes and you will not be able to use them. Of course, even these earbuds you can sometimes remove. If you buy a new one like this one, I'm still keeping the box, so they normally come with some extra, just in case you lose your diaphragm. Then there is this one, is the same as this. You simply replace it, or even the earbuds or the earpieces are here. If one is spoiled or one is lost, sometimes they can drop when you are not seeing. You simply use this one. But for now, mine is still okay, so I will still put it. And sometimes this is a very good storage for it. You simply, when it is not in use, you simply fold it and return it to where it is very, very nice. Put this one, and then you close it and keep it. Because most of us, we normally travel this in the hospital, because we forget these ones in the house. Of course, It comes with a manual of how you can use the stethoscope, and this is from Littmann's company. So this manual is very, very important. It will even show you those things I was talking about in the video. So when you are a student and you want to join medical college, do not buy those stethoscopes that are 280 or 300. This is it. Go for Littmann's. It will really help you to differentiate those sounds that I'm talking about. If you really love this channel, please hit the notification bell, and subscribe. Turn it on for more videos that I will post. Muchas gracias.